Hi, I'm Dr. John Willardsen, Trust Implants. So we get a lot of patients who come from all over the country and other parts of the world. We have patients who come to us that haven't been to a dentist for many, many years, and they need all of their work done, possibly losing all of their teeth. But with this, we get a lot of patients who have had implants done. They've taken the effort to get their work completed. And as a patient, how do you know who to go to? How do you know who's going to use quality materials? How do you know who's going to use quality surgical technique, quality prosthetics? As a patient, it's very difficult to know. You have to really do your research. So I'd like to take a look at a case here that came to us over the last couple of months. And you'll notice he's had a lot of implants. In fact, you know, he did his research. He went to, in his mind, who was a well-renowned surgeon in his area. In this case, they did about four years ago they started. He said that it took him about 2 years to finish. So in reality, this case is only about, completed about 2 years old. And I look at this situation where he's got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 implants. And so he's got a good $100,000 invested in his mouth at this point. And you'll notice on the majority of these implants, there's a lot of bone loss. You'll see, like right here, this implant is basically hanging on by a thread, the apex or the tip of the implant, maybe a millimeter, 2 millimeters at the most. So he's lost all the bone around these implants here. And same thing back here, a lot of bone loss. And why is that the case? Partially, it could possibly be, patient compliance if he's not brushing, flossing, irrigating, maintaining the prosthesis. But with that is the materials. So he has 13 implants, and they were from 5 different manufacturers. And not that that's such a big deal, but it does tell me where's the continuity. When you come to Trust Implants, we use one brand of implants. We maintain that systematically throughout the entire case. I would never take, just because I needed to get rid of or use a certain implant, take off the shelf one brand and then put in another brand in the same patient's mouth at the same time in the surgery. So this patient had 5 different systems in their mouth. Surgery was done on the same day back 4 years ago. So it screams a lack of confidence. It screams a lack of continuity to the case. And in reality, it almost kind of says they don't really care about the patient. They're just trying to get rid of implants that they need to get rid of that they have been sitting on their shelf for a while. I don't know the details because I wasn't there, but there's just certain things that when I see a case that it kind of tells me a story, right? Every single case tells me a story. And so we went ahead and took it apart and removed everything. And in the end, I had to remove pretty much all of these implants. I had to remove every single one of them. And it required me, once I removed the implants, to remove an implant it's no joke. Like even though this implant was only held in place by a millimeter or 2 of bone, I still have to remove that bone in order to remove the implant. So I look at a couple of things. One, how is the hex of the implant? Is it intact? Is it stripped? Is it worn? And or how much bone loss do I have? And all of these, because of the quality of the implant, the hexes were very worn. In fact, the doctor had prepped part of the implant to make the crown, I suppose, seat better. He tried to prep the threads to try to minimize the adherence of plaque and debris to these implants that were now exposed. So again, the ethics of this case, there's not a whole lot of ethics that went into this case, and it's the patient who suffered. Because of the lack of ethics on the doctor's side, the patient is the one who has suffered because he's had to redo this case, and he's already spent the money to do it. And so if we look at what we ended up doing, we'll pull up his post-operative CAT scan. and look at what I ended up doing for him. So we went ahead and removed all of the implants. I put in 6 implants on the lower arch, 8 implants in total. And then if you'll notice up here, we had to do a bone graft to regenerate the ridge, because once those implants, his old ones, came out, the bone was completely destroyed. But you can see here how nice and fat that ridge is. And if I were to go in and technically place an implant in these areas, now I've got sufficient bone. This is a titanium mesh onlay graft that we used to regenerate the bone. So now I've got great bone. I have bone on the front side or the back side, the buccal, the palatal. I can put a nice fat wide 5 millimeter diameter implant by 13 in this site. And I can do that throughout the entire arch. And so, but the issue is, not that we can't correct these cases. The issue is the patient had spent a lot of money, a lot of time, and now is having to redo this case. And so my advice to patients who are considering this work, because it's an investment in time, financially it's an investment. When it's all done, it's so worth it. It's such a transformative procedure. It transforms everything. Your confidence, like we've talked about in all of my videos, pretty much. Your self-confidence is restored. Your ability to chew and eat and laugh and smile and just feel good about yourself is all restored. But it can go backwards if the quality of materials are not there. I have a lot of videos discussing different materials, commercially pure grade 4 titanium versus titanium alloy. And when we do cases like this, there's so many materials involved. The graft material, from the type of extraction, how you do the extraction, how you do your bone graft, what materials you use for the graft, how you prepare the osteotomies or the holes to place the implants, and then the materials of the prosthetics. All of those things play into it. And they all tell a story, like in this case. And so here at Trust Implants, we will only provide you with the very finest materials, the very finest prosthetics, and the very finest surgical technique in order to avoid having situations where you've spent and invested a lot of time and money and effort, and then in the end you have to redo it all over again. So it's worth taking that extra time. Even we have patients that drive from all over the country, that come drive or fly. One of them drives from Texas, but they come from all over the country, but it's worth it to them because they know what they're getting. I'm Dr. Willardsen, and thank you for watching.